All right, so I checked the order, see that they've got they got a baseline assessment, they've got their oral meds due, and they need a Foley catheter. So I check all that. Knock, knock. Hi, Mrs. Lynn, I'm Garrett. I'm gonna be your nurse today, and I'm just gonna do a baseline assessment for you. I'm gonna get you your meds, and we're gonna do a catheter for that urinary retention that you're having, okay? Can I get your name and verify your date of birth? Okay, and I checked their tag, and that looks good. Perform hand hygiene. And I've closed the doors and curtains around me to secure or to protect their privacy. All right, Mrs. Lynn, can you tell me where you're at today? Okay, can you tell me who the president is? All right, and can you tell me what month we're in? Very good. All right, I'm just gonna check your eyes real quick. All right, I see that their pupils are round, equal, and reactive to light. I'm just gonna take your vital signs real quick. After I do that, I see that the blood pressure is 112/62, so that's perfect. Pulse is 65, which is well within normal range. Respiration is 16. Room air is 96%, or oxygen is 90% on room air. And temperature is 36.9 degrees Celsius, so that's all within normal ranges. I see that she doesn't have any allergies and takes no medications already. And then I'd assess their face, see if there's any deficits, any drooping. That all looks good. All right, Mrs. Lynn, are you having any chest pain today? Okay, I'm trying to take a quick look and move this back. I inspect their chest, see that it all looks, see if it looks okay. Any skin lesions, anything like that. All right, I'm gonna go ahead and listen to your heart. Okay, if I touch around here, all right. In all 5 points. All right, that all sounds good. And then, are you having any difficulty breathing right now? No, okay, that's good to hear. I'm gonna listen to your lungs now real quick. Take a deep breath in, and exhale, and again, and again, and again, and again, and one more time. And then I'm going to switch to the back as well. Listen to all 6 points. That all sounds good. There's no wheezing, no crackles in the lungs. I'd also ask them for a pain scale. What's your pain on a scale of 1 to 10 right now? With 10 being the worst pain you've ever had. And I see that her pain's under control off that, so it's probably a 1 or a 2. Okay, next I'm gonna look at your abdomen, see if that's all looking good. See a little bit. I'd first inspect, see if there's any bulging, any skin lesions, any wounds, anything like that. I'm gonna feel around. Any pain right there? Or first I would listen. No, I'm gonna feel around first. I feel any pain right there, and there, and there, then right there. There's no pain. Go ahead and listen for any bowel sounds. In all 4 quadrants. I can't remember if I did, but I'd ask if there's any pain there. All right, now I'm gonna assess your skin. I feel for any edema, any turgor. Pressing and pinching to see if they're dehydrated at all. I'd assess their pulses on all 4 sides. You feel it there. There. I'd look for cap refill. See if it's at 3 seconds. It is. Right. Can you squeeze my hands? And push down on my hands and pull your feet up. All right, and now I'm gonna assess gait. How do you walk to that door and back? I look for any unsteadiness, any shaky gait. That all looks good. I would then go ahead and I would ask about like the last time they went to the bathroom. When was the last time you had a bowel movement? So we'll assume it was about a day ago. And the last time you in any problem, and now there's difficulty urinating, not having urinary retention. Any pain when you have urinated, and any foul smelling odors, anything like that. Okay. Take my gloves off. For hand hygiene. Okay, now we're gonna do your oral medications. This is gonna help with your nausea and your nausea. And then you have an antibiotic, which is your Keflex. So we need to do Zofran and Keflex. Perform hand hygiene. Let's get some more gloves back on. Well, let's pull up my computer first. So we're not touching stuff with clean gloves. Grab my meds, get all this ready before I go back into the room. And as I prepare my meds, I'd shut the med drawer and lock it. As I'm going to verify that I have the right meds, so I have the Zofran and the Keflex. I see that's good. That's my first check. And Knock, knock, get into the patient's room again. Hi, Mrs. Lynn, I'm back. We're just going to do your oral meds. I'd have her verify her name and date of birth again. Zofran first. Scan the barcode. Oh my goodness. It didn't work. Scan it again. Nice. See the problem here. Now we're going to scan the patient barcode. This is why we do this, so we're not on the wrong patient. Okay, that's good. Perform some hand hygiene. And make sure I have closed all the curtains and doors. I know that she doesn't have any allergies. Gloves on. For my second med check right here. Scan that. So glad that's working. Pop the med in. Make sure I have the right dosage. 4 milligrams, 4 milligrams. And then we prepare one med at a time. I verify I have the right patient, right drug, right dosage, right route, right reason, and right time. And that's all checked off. And like I mentioned, Mrs. Lynn, this is gonna help with your nausea. I'll assist their bed up a little bit, so they're not laying down. They take it. We don't want to cause any choking. All right, here's the med. Give that to them. Some water to drink it down. Excellent. Make sure I have this all documented. Okay, then we have the Kefla. This is our second med. Do my first check. Well, my second check is I already did my other check over there. See, I have the right dose. And this is 250 milligrams, and the dose she needs is 500, so we do 2 of these pills. Okay. 1 pack of these. 2 of those. scan the drug. Excellent. Verify it's gonna be the right dosage. I got 2 of them, right route and right time, right reason as well. Antibiotic. All right, here's these. Water. Excellent. Take off my gloves. When I'm doing other med, I'd take off my gloves before I'm hand hygiene and put on new gloves. That's something I should have done. My hand hygiene done. And then I'll come check on you in about 2 hours, see if, or about 30 minutes, see if those meds are doing good. And try to lower their bed back down. And then I would document, and I'd come reassess them. I'm gonna clean up a little bit just so I have clean working space. And then do the fun one, the Foley catheter. Knock, knock. This is Lynn. You're about 30 minutes to check on the meds, and we're going to do a Foley catheter for you and help with your urinary retention. Hand hygiene. Gloves on. I got my supplies ready right here. Bringing this clean table over to the patient. The trash can as well. Excellent. That's what I meant to do. Gloves on. I'd verify their name and date of birth again. I don't know if we're supposed to go through like all like the processes that we like the very beginning processes, but I would verify name, date of birth, close all the surrounding doors, tell them what we're doing. So we're gonna do a Foley catheter this time around. Yeah, verify that. That looks good. Get my supplies ready. Okay, I'm gonna pull this back a little bit. I'm gonna expose them ever so slightly just so I can see what I'm doing. Okay, I'll clean one side, fold, clean the other side. Or I'd go top down, and then the middle, throw that away. struggled to open this last time. I'm gonna struggle opening it again, but that's life. Never mind. I would take these gloves off and perform hand training, put new gloves on now that I've cleaned that off before I would open this. You don't want to be touching this with dirty gloves. It's not a good idea. Doesn't want to open up for me. Making sure we only grab the 1 inch perimeter. We're not going to use these gloves. Okay. Now I'm going to go get my sterile gloves on. Move those. Perform hand hygiene. Bring these over here. Still only touching the 1 inch perimeter. Grab. Out of here. Before I put on my sterile gloves, I would assist their legs in position. Since I have my sterile gloves on, I'd have an assistant help me, and I'd have them, yep. Thank you. Just fold it over like that. Make sure I stay sterile. Over there. All this fall open, so we're not shaking it out, because that's not good. go ahead and make sure I have all this ready first. Run this. Okay. Get our lubricant ready. You want to lubricate this very generously. And I don't remember if I did. I think I did, but I explained this procedure to the patient. The Foley catheter goes inside of the urethra into the bladder to drain any urine. Explain that it can be uncomfortable. Have that all lubricated. This is still sterile. Right here. So we can, she doesn't touch anything. That's what we need sterile right there. Grab these. Now I'll break the sterile field on this one hand by spreading this, and I'll go on one side, throw it away, the other side, throw it away, and down the middle, throw it away. Struggle to get this out. Okay. There we go. 3 to 4 inches in. And then until we see some fluid or some urine coming out, we go a little bit further. Inflate the balloon inside to keep it in there. Okay. Now that that's in there, okay, if I'm not sterile anymore, we would, and that's because this isn't sterile, water squared a little bit. Throw this all away. I didn't grab, normally I would grab something to secure this down with, and I'd secure it right here just against the leg so that it doesn't get yanked on, anything like that. Go ahead and lift that. I can see that that's in there. Throw that away. Throw that away. I don't think we have one. We don't have one, okay. This is the time where I would grab a urine sample if I needed one. And these off. Go ahead and hang the bag on the side rail. Side rail to hang it on. Get that hung right there. Help the system back into a normal, comfortable position, however they might want it. Like I said, we'd have this secured right here. Pull it back up. Throw all these supplies away. I would grab my handy dandy pen. After I took off those gloves, I performed hand hygiene. I think I said that. I would perform hand hygiene. I would write what time it is when I put this on, and I could go ahead and apply that to the thing that's holding it down right there. Probably give me my pen back right here. Clean up a little bit. I've asked the patient if they have any questions, and I tell them I'd come back and check on them in a few hours, see if that catheter is working well. And then say thank you for your time, and I would go and document all the procedures I've completed and check on them whenever I needed to.